somebody could give me a wave to let me know that, because it says it's currently unmuting.
I can hear you, Carmel.
Oh, brilliant. Great. Thanks, June. Good afternoon, everybody. Special thanks to the People for Public Services Forum and to Fiona for allowing us to come this afternoon to talk to you about the new preparation for adulthood strategy that is currently being rolled out across the city. Unfortunately, my colleague Jackie isn't able to be with us today, so I'm going to do the presentation in two parts. So there'll be an opportunity for questions or comments in the middle. So the preparation for adulthood strategy, why are we having a preparation for adulthood strategy? So we know that for young people as they approach adulthood, lots and lots of young people experience challenges and barriers to them being able to move forward into the kind of adulthood they'd wish to have. And obviously for a lot of young people in the city, those challenges and barriers are extremely difficult, and particularly for young people with special educational needs or disability, and for young people who are impacted by childhood trauma. That means that it's going to be difficult for them to move into the kind of adulthood that will enable them to have a rich and fulfilling life without a level of support, and also could leave them vulnerable to things like child sexual exploitation, domestic abuse, drug and alcohol use, and offending behaviours. So we are looking to work with young people and engage with young people across the city so that we are able to support them into the kind of adulthood that they wish to have. So who are we? Well, we are part of Birmingham City Council. We sit within adult social care, but we're a bridge between the adult social care and Birmingham Children's Trust, and we're also working alongside the Birmingham Solihull Clinical Commissioning Group. So we're well embedded in those structures within the city, and it gives us an opportunity to be able to feed back to senior management across those organisations what we are finding as we're working with young people across the city and the kinds of things that we think need to be changed or made different. So what is our vision for the young people that we're going to be working with? We want every young person in Birmingham to have a rich and fulfilling adult life, and we want to be able to support them to overcome the issues that they are currently facing that make that difficult for them. We are very much about people having equal chances. We don't want a sort of 2, 3, 4-tier system where young people aren't able to take advantage of the opportunities that others have because of issues that have either because of disability, learning disability, or because of issues that they've experienced as children. We want the young people we're working with and their families to be at the centre of all the planning that we are going to be doing to support them to transition into adulthood, and to ensure that they are fully involved and at the centre of everything that we do. We want to ensure that people are able to have the right information and support in a timely manner, to give them time to think about what they would like to do, what is available, and to make some decisions without them at all having to be very rushed, or that they've got actually opportunities to explore what their options might be. And we're very committed to ensuring that nobody gets left behind. So it's very much about young people across Birmingham being supported to be able to have the kinds of adulthoods we would all like for ourselves and for our own children. So how are we going to achieve this vision? So the preparation for adulthood strategy has been introduced. There are 3 parts to that. I'm part of the integrated transitions team, and we are going to be working with young people, supporting them across our 4 outcomes that I'll refer to later, and ensuring that any issues or aspirations and dreams that they have, we're helping them to achieve. We're going to be supporting them to develop something called a community circle of support, and I'll come back to that later in the presentation. The preparation for adulthood strategy is currently a pilot that is running until March 2022. And as part of that, you know, we might come back with a presentation that will look very different to this in a year's time to speak to the Public Services Forum, because we will be changing and adapting our offer and what we're doing as we start to work with young people across the city and their families, and to see what kinds of things they want us to actually be able to do and what we're uncovering as we're doing that work. There has been a commitment to a further 3 years of funding, provided we're able to demonstrate that we're able to make a positive impact in the lives of the young people we're working with, and we're very optimistic and confident that that will be the case. We are very much an additional service, so we're a non-statutory service. We are not replacing anybody. We're in addition to, not instead of. So if you are involved in teams or with services that already exist within the council, we are not replacing any of those. This is an additional service to support young people towards adulthood. Thank you, Simon. So that's the first half of the presentation. So very happy to take any comments, questions, and thoughts about what we've said so far.
So, Carmel, we've just had one question in so far, actually. Can you all hear me?
Yes, can.
Brilliant. So the question is, how do you interact with other groups within the city for young people?
How are we going to interact? Well, we've been in post since the middle of May. We've been talking to lots of services, both within the council, outside the council, within the health service, within the combined authority, and lots of community organisations as well. And we are trying to kind of spread the word far and wide. We spent August doing a presentation similar to this one to basically anybody who'd listened to us. We've been out talking to lots of different people, answering questions, and we're hoping that you will also help us to spread the word, that the people attending the forum today will be interested in more information and be able to tell anybody that they think in their local communities or in their homes that they think might benefit from our service about it and how to connect to us.
Thank you, Carmel. And the next question I can answer, actually. So, Sadie, you've asked if you're able to get the presentation to share with teams following today's event. The simple, straightforward answer is yes. We will share this presentation with you. As Carmel said, she's very keen to get the message spread far and wide. So, yes, absolutely, that will be with you later on today. And we haven't had any further questions in, so I suggest you carry on, Carmel, because I'm sure there'll be more.
I'll have a sip of water before I go on. So how is the preparation for adulthood teams going to be working? Well, we're very much focused on what the young person wants. We're not about these are, you know, you've reached a certain age, these are your 4 options, which of these 4 options do you want to have? We want to be able to work, as we said, with the young person at the centre of any planning that we are doing and the work that we're doing, to ensure that what we are supporting them to achieve is what they actually want to do and what they want to have in their adulthood as they transition into it. We're very much about raising aspirations. We want all the young people across Birmingham with additional needs to have aspirations, to have goals and dreams that we are going to help them to realise. I mean, obviously there, you know, it's not going to be a straightforward process, but we will be there to support them to achieve what it is that they would like to work towards. We're also going to be, in terms of kind of connections, and we're going to be system connectors. So we want to be able to kind of connect families and services into to each other, to ensure that young people and their families have the right information and are aware of all the vast range of things that are available across the city that they might be able to make use of. And in addition to being system connectors, we're very much about system change as well. So in addition to working directly with young people and their families, we will also be feeding back to senior management changes that we think would be helpful or difficulties that there are in the system that make it difficult for young people. So we're very much about producing, and this presentation today we've co-produced with the Citizen Engagement Panel. So we're very much about making sure that everything is joined up, working with families at the centre, and ensuring that the young person's needs and what they want to achieve is centre to all the planning and work that's going on. And because we're a non-statutory service, we are actually able to go on to spend more time and be able to support the young people and their families in a slightly different way. So we are hoping to be able to work very closely in conjunction with our colleagues in statutory services. Thank you, Simon. So how are we going to know that we're making change? So we're concentrating on 4 specific outcomes. We're looking at health, housing, employment, and friends, relationships and communities. And everybody who makes an inquiry to us, we want them to be able to identify some issues or goals that the young person has in relation to these 4 outcomes, so that we are able to demonstrate with the time that we spent with them and working to help them to support getting these issues resolved or their goals realised, that we're able to make a difference. So that is how we're going to measure what we're doing, and we're concentrating very much around these 4 outcomes, which obviously are very broad and kind of encompass a lot of the aspects of a young person's life that is going to impact them as they move towards adulthood. Thank you. So who will we be able to support? So we're going to be supporting young people aged 14 to 25, which is a change in the age range that historically we've been supporting young people with transition to adulthood in. So we are going to be supporting young people with special educational needs and disability, young people who've been identified as being vulnerable or in need of support through statutory health or social care assessments, young people who, because of childhood trauma, may be vulnerable as adults, and that vulnerability may continue to impact them as adults if they don't receive early support and help to overcome that. And we're also going to be supporting young people who are carers. One of the unique features of our offer is that if we start to work with someone and there are siblings aged between 16 and 25 in the household, we are also able to engage and work with siblings to support them should they wish to do it. But we are a by invitation service, so it's very much for young people to decide whether they want to engage with us or not. They don't have to do so, and it would be the same for their siblings. But we recognise that working with a young person who has siblings who are impacted by some of the same issues isn't, because we're about wanting to be able to sustain the change that we're helping to make and ensure that's consolidated and follows through with them. So being able to work with siblings will help support that. So obviously we've had to look at where we start, and as I say, we're in a pilot, so this may well change, but currently we've identified a number of groups of young people who we're not currently going to be able to support. So, and that includes young people requiring palliative care, people with life-limiting conditions and complex long-term conditions, and any young people who are currently in custody or in the secure estate in a young offenders institution or secure children's home, for example. But of course, being a pilot, that may change, but this is where we're starting from. And we're very much about not wanting to say, sorry, we're not going to help you. So we will be offering to signpost or to offer alternative support in situations where there is already a plan in place for a young person that includes our 4 outcomes I referred to earlier. So we're not in a position to be able to kind of duplicate work, but we want to ensure that we are getting to the young people who most need it. So if something's already in place that includes our 4 outcomes, we would be signposting people to sort of alternative places or offering them the opportunities to engage in other services, or indeed where a service already has specific specialists in posts. So for example, we have a dedicated employment officer, we have a dedicated housing officer. If a service already had people in similar posts to that, but required help around employment or housing, then we would be offering, you know, to signpost them. And we're also not going to be able to work with a young carer who hasn't had a carer's assessment completed in the last 12 months. But obviously what we would be wanting to ensure in this instance is that the carer's assessment is completed so that the young person can access the support that's available to young carers across the city. So we have a very wide range of people who can contact us. We're not talking about referrals, we're talking about connections. So I see this is just you know, a snapshot of the range of people who are able to connect young people to us. But I'd like to draw your attention specifically to young people are actually able to refer themselves. They can contact us, as can their parents or carers and family members. So and again, that list isn't exhaustive. Now, obviously, COVID-19 has had a huge impact on all our lives, and as a service, starting a new service, we obviously haven't been. We've only just started to engage with young people from the 1st of September. So we've been looking at 4 separate work streams across the directorates that the Birmingham City Council Strategic Life Course Board have asked us to look at. So we've been looking at youth custody, and what support is there. We've been looking at supported accommodation, particularly around houses of multiple occupancy and the vulnerability of people who are living there. We've been looking at community circles of support, and we've been looking at the day opportunities that are available across the city. I'm going to come back quickly to the community circles of support, because the community circles of support is something that we are going to help each young person we are working with, provided that they wish to do so, to develop their own circle of support whilst we're working with them. The idea being that the circle will be an ongoing source of support for the young person, both to help them sort out any issues that may arise, but also help them kind of achieve their goals and aspirations on a more long-term basis. The circle is very much in the young person is in control of the circle. They decide who is part of their circle of support, where and when they meet, and the circle is going to be facilitated by a trained facilitator, and we're currently in the process of identifying a training partner to be able to offer that training to people. And what we are looking to do is to recruit facilitators in the communities that young people live in, to be able to kind of take, you know, support the young person to take their kind of issues, their goals, their dreams, and help turn them into action, and use their community circle of support as an ongoing long-term source of guidance, and somebody that they can go to when there are issues that are causing them some difficulties. So, and that is the end of the presentation. So thank you very much. Are there any further questions, June?
Oh yes, Carmel, there's some coming in now.
Right.
So
okay.
Some of them we've answered. So one of the questions was, what age group are we going to be working with?
Yeah.
But then you covered it in the next slide. And then the next question was, how are you defining young people? What's the eligibility? But again, you confirm that as well.
Yeah.
So the next question, which I couldn't answer, is what about young people with no families?
Yeah, well, we will obviously be working with young people with no families. That not having a family is not a bar to us being able to work with you, but we would have to ensure that, you know, we were able to work with you around our 4 outcomes. We have to be able to identify that there is work to be done around those, and really that isn't a bar to us working with somebody, as we said. It was just that we are very much aware that the young people we work with, we want to be able to kind of include their families, their parents and carers, if there are parents and carers. But for example, if we had young, lone asylum, young people who were lone asylum seekers, or anything, somebody who was on their own for whatever reason, then obviously we are still able to build a connection with them, provided there is work to be done around our 4 outcomes.
Perfect. Thank you, Carmel. Next question we have is, sorry, I missed the very beginning of the presentation. Do you have connections with the virtual schools? And that question is from Sadie Hughes.
We have been, a lot of groundwork has obviously been done around services, and Linda Harper is our strategic lead. To be honest, I would expect that is the case, but I couldn't say for definite, but I will double check and come back to you. Perfect.
Next question then. Nothing like putting you on the spot this afternoon, Carmel.
That's okay. I knew that was happen. That's what we're here for.
Absolutely. How would your team be working with housing needs? Will you be providing accommodation or supporting the person to obtain a property? And what will be the follow-up? And that's from Nina.
Right. So there's three parts to the preparation for adulthood strategy. There's ourselves as the integrated transitions team. There is in the process of being currently put together a vulnerable adults team, and then there is also a transitions hub, which is going to be commissioned to across the city. Now the transitions hub will be focusing on young people who are either homeless or at risk of homelessness, and the plan to date, but again, as I say, we're in a pilot, so this is subject to change and alteration, is that the transitions hub will include some accommodation, so we will hopefully be able to support young people. I mean, we're very aware of what a difficult issue obtaining housing is across the city, but we will be able to support young people with applications and been able to hopefully kind of move towards a property. And this is where their circle of support will come in, because once we're going to work with young people in 3-month and 12-month blocks, depending on what they want us to be supporting them with. And once we have finished working, the community circle of support will be able to kind of continue to support them with issues around some of, housing, health, some of the issues we've arisen. But we're very aware that, having said that, housing is a very real issue in the city, and being able to obtain suitable properties. But we are looking at the whole issue of kind of supported accommodation as part of the COVID-19 work we've been doing. So we will, as I say, sorry, this is a rather roundabout way of answering it. There hopefully will be an element of accommodation available through the Transitions Hub. We do have a housing solutions broker as part of our team. So if somebody with a dedicated remit to support housing, and we will be doing everything we can to ensure that young people are moving into appropriate housing where they are going to be safe and it's going to be sustainable.
Thanks, Carmel. We've got, so following nicely on from that comment, so Joanne Spence is on from Trident Reach. Hello. So Joanne said, Trident Reach is a commission provider of lead worker support and accommodation for young people and would welcome involvement with the preparation for adulthood team. Brilliant.
That's great news. Thank you. Thank you.
Brilliant. Your next question, I think you may have just covered it. Supported accommodation, what would be your team's roles and responsibilities in the process of working with the person?
Well, we're a non-statutory team, so we're there by invitation. So we will work with young people for as long as they want to continue to work with us. And our role would be to to work with rather than do for. So we'd be working with the young person to help kind of identify what kind of housing they would be interested in obtaining, what the issues might be around that, and ensuring that we've spent a lot of time looking through kind of potential problems that might arise, ensuring that people are building independent living skills and understand, about rent, etc., etc. But as I say, the plan at the moment is that the Transitions Hub will have an element of accommodation in it, so that young people who are particularly vulnerable will have the opportunity to utilise that. But again, that's sort of in the process of being put together. We're a very new service, so we're just kind of finding our feet, as it were.
Brilliant.
Does that answer your question?
I think so. So the next question, Carmel, is what are the 3 strands of the strategy?
Okay, so the three strands of the strategy is ourselves as the integrated transitions team. We're going to be working with young people aged 14 to 25. We're going to be working with their siblings if they're aged between 16 and 25. And the other unique element of our service is that somebody doesn't need to have a diagnosis in order to be able to access us. So it may be that you have behaviour that would lend itself to a particular diagnosis. You may be in a process of awaiting a diagnosis, or you may feel you've been incorrectly diagnosed. We will still be able to work with you, provided, as I say, that we're able to identify things within our 4 outcomes that we're able to support you with. The other two strands are the Transitions Hub, which I've referred to. That's going to be a commission service, still sort of in its infancy. And the Vulnerable Adults team are going to be working particularly with young people who've been subjected to trauma of some kind in their childhood, who without sort of early support and intervention will make it, you know, that trauma will continue to cause issues for them throughout their adult life, and mean that they have to keep coming back into services or require possibly things like acute mental health intervention. So we're very much about, you know, early working with people early to try and prevent some of the huge challenges that a lot of the young people across the city experience, not being the thing that prevents them being able to have a rich and fulfilling adulthood.
Lovely. Got some more questions from you. So Nikki Petite, I hope that's how I've pronounced that correctly. Nikki's commented 3 times, so I'm going to do all 3 together for you because I think they're all linked. So Nikki works at UHB. Yes. How can we signpost the opportunity and raise awareness of the great service you are offering? And can we help with the health outcome at all?
Oh, right. Okay. Yes, and yes. We'll be sharing some information with once we finish the questions about how to contact us, and we'll certainly be interested in people both helping to connect young people to us, and if they feel there's aspects of their service that would lend itself to us, then absolutely we want to be able to kind of connect people up. We want to be working in a joined up way where we've got a lot of kind of creativity, we've got a lot of opportunity to really make a real difference here, and we're a very determined and passionate team. And Claire Mulby, who's our team lead, is on the forum today, and I'm sure she would agree with that. We're very determined that we're going to be a success because it will make such a huge difference to the young people across Birmingham.
Brilliant. Next question from Nikki was, have you linked in with the Prince's Trust?
Yes, we have. Our employment officer has had meetings with the Prince's Trust. We have. Okay. But if you think that if you have a particular person you think it would be helpful for us to speak with them, please obviously do come back. It's a big organisation. I know our employment officer has had connections, meetings with them, but it may be that there's another aspect of the Prince's Trust we could meet with. So please, we'd rather have too many people than not enough. So please, if you think there's somebody useful, please do let us know.
Fantastic. So another question from Nikki was, how will you advertise the opportunity to become part of a community circle? Will the people have to be local? It may be something that we can advertise through the trust. I think plenty of people would be interested to volunteer and take part and support.
That's brilliant. Thank you. Well, that's certainly what we're very hopeful for, Nikki, is that people will volunteer. We're in the process of putting some information together. We've had some bids in for the facilitation training. They're currently being looked at. We are very keen that it is local. We want the young person to be able to have, particularly the facilitator, who has lived experience of the same communities that the young people across the city live in, so that they're able to build a real relationship of trust that is hopefully as long-term as any of us can make long-term plans, and be a kind of a constant in that young person's life during this very, challenging kind of time, to enable them to be able to kind of go on, as we say, and have the kinds of adulthoods we would want for every child, every young person across the city. So absolutely, if you think that people across the trust would be interested, please do get in contact with us, and we will keep you updated as we have more information. Thank you, that's great. Thanks, Nikki.
So my next question is, somebody's asked if Alan has asked if we want a partner organisation that could help house young people. I think that's a conversation with you directly afterwards when you put up how people get in contact with the team.
Yes, it is.
There is also somebody else asking if there's a direct contact to get involved with the team. How can we get involved? So that's really positive. Thank you.
Yes, thank you. Thank you.
Sadie Hughes has commented and said, I work for Bernardo's with some of the young people you may be able to support or work in partnership to support. How can you let you know what we are doing?
We're very happy to meet with you, Sadie. That would be great. We have met with the somebody already from Bernardo's around their employment offer, but very happy to meet with people and share. We're very much about getting our message as far and wide across the city. What we absolutely want to ensure is that anybody who would like to make a connection to the service knows that we're there and is able to make it. And similarly, if people want to help and support in any way, work together, be able to kind of form, networks, be able to link families into organisations and help they may not already be aware of, we're absolutely up for all of that. So thank you. That's great. I feel really passionate now. Thank you so much. It's great that people are so enthusiastic and positive about it. That really,
we're getting some fantastic comments through
to the team.
So, Carmel, just going to another question. We haven't got many more in now, you'll be pleased to know. What skills would we be offering for initial independent living skills?
Well, as I say, we have a housing person as part of our team, and she has extensive experience of supporting young people with independent living skills, but we'd also want to be able to help connect young people into support that might be in their community to help them to develop and consolidate those skills. So yeah, we're if you're asking that because you think there is something that you may be able to do to help with that, then please do get in contact with us. We're very aware that there's going to be a lot of young people out there requiring support. We want to make sure that the work that we're doing is positive, moving young people in the right direction and sustainable, that it's, which is where the community circle of support will be able to come in and offer further help. But we're also very aware that there may well be people out there, who mightn't want to necessarily train as facilitators, but could be part of somebody's circle of support to be able to help them with issues like independent living, accessing the job centre, accessing, community services, anything like that. Yeah. What we're really hoping to do is be able to build on the absolutely incredible response there has been across this city to lockdown and people supporting citizens through during COVID-19. That has literally been just the most amazing response on behalf of people across the city. So we're hoping to be able to build on that so that people are able to kind of support young people with additional needs in their own communities.
Great. So I've got a comment more than a question from Sadiq. Thank you, Sadiq. Young people need mentoring by a mentor and mentors who are trained and qualified. Yeah, I think that goes without saying, and I know there is training planned for those people. I've got another comment now from Rose. Rose reads, as an employer in the rail and construction sector, offender friendly, we would like to help with career information, advice and guidance if needed. Brilliant. Can I ask Rose then if you will just send your details to one of the emails that are up on the screen at the moment. I'm Carmel Cork. I think I forgot to properly introduce myself at the beginning, telling you at the end, and we're very happy to kind of pass that on to our employment officer, and to Walter, so that he can follow that up. Thank you so much. That would be great. Thank you. And that brings us to the end of all the questions that have been posed. But if anybody just wants to look at the published Q&As that are on screen now, there is also the generic email address for the team also in the email box, in addition to all of the others that are on screen. That's all the questions from me. So I think, do I hand back to Fiona? Is Fiona taking it back now? Thank you, Carmel. That was really good.
Yeah, thank you, June. Thank you. And can I just say thank you very much to everybody. That's been so lovely to have so many positive comments and offers of help. You're just amazing. We're really, you know, we feel really passionate about it. We really want to be able to support young people across the city, and you've just been able to demonstrate how helpful and willing you are.